When I was a med student, I was very fascinated about pacemakers. I just thought it was very interesting that we could put in a device and then it keeps people's heart beating. So it was really pacemakers that got me interested in cardiac electrophysiology. I super specialize in syncope, which is when people pass out. And that's kind of the focus of my practice. But I do all aspects of heart arrhythmia. Syncope is obviously a very concerning symptom. The patients themselves, their family, their doctors, they get very concerned. Syncope can be a harbinger of something very serious, something dangerous. For most people, it's actually very benign. And what got me interested in syncope is when I was fresh and young and I was straight out of training, I would see people that were passing out and I knew that they didn't need a pacemaker or a defibrillator. The very first thing is to get a plan for what the workup is, and you always need to understand what's going on before you get to treatment. So I think one of the complex things about syncope is there are not just specific tests that you would do for syncope. And so it's kind of old-fashioned doctoring where you really have to take a lot of history. You got to get a lot of the details about the episodes that happen. Most of the patients I've seen have already seen numerous physicians before. They've already had a ton of testing, so we spend a lot of time reviewing all the work that they had done. And we try not to repeat everything that was done. We try to build upon what's done. So the first visits tend to be pretty long, and it's mostly conversation. I typically will do things in tiers. I have my first line testing, and most times I've been doing this long enough that when I speak to somebody, I have a pretty good idea what we're looking for, and I'll do directed testing for that. Start with a general layer to kind of get a feel for the more common things that cause people pass out, and then that kind of helps me kind of hone into more specific treatment. And then follow-up visits really depend on the nature of the symptom. I have patients I've taken care of for almost 20 years and I still see them. It's great because you've known them for a long time. You really get to kind of know each other, develop a relationship. That is absolutely my favorite part of my practice.